All right, let's get right into it. Today, we're basically going to become medical detectives. We're on a mission to solve one of the most important puzzles in all of healthcare, creating what's known as the best possible medication history. So let's start our investigation. It all kicks off with a question that sounds so simple. A question you've probably heard a million times. What medicines do you take? But as you're about to see, the answer is almost never as simple as it sounds. But here's the thing. That question is way more complex than it looks. There's often this huge gap between what a doctor thinks a patient is taking and what they're actually taking at home. And that gap? That's exactly where serious medication errors and patient safety problems begin. And that's why this is so important. The stakes are incredibly high. Medication errors cause thousands and thousands of problems for patients and hospitals every single year. Getting a truly accurate answer to this one simple-sounding question, well, it's our first and honestly our best line of defense. So, the big question is, how do we get to the truth? Well, there's a specific expert technique for this. It's called the best possible medication history, or BPMH for short. You can really think of it as the essential toolkit for every good medical detective. So what is a BPMH? It's a step-by-step process. You're interviewing the patient, you're digging into other sources, all to build the most accurate, the most complete list of all the medications a patient is taking. The key words, the ones that matter most, are actually taking. It's the difference between a pretty good guess and the absolute truth. And that's why I really want to stress this. This is so much more than just a list or some form you have to fill out. It's a real conversation. It's a focused, dedicated interaction that, and I'm not exaggerating here, can literally save someone's life. Okay, so you're on board. How do you actually do this? How do you master this conversation? Well, like any good investigation, it all starts with finding those first critical clues. And that means you have to set the stage perfectly. Before you even think about asking about a single pill, you've got to build some trust. I mean, that's step one, right? Make sure you have the right person, tell them who you are and what your role is. And this is huge. Ask for their consent. A simple question like, "Is now a good time to talk?" makes all the difference. It shows respect and it makes the patient feel like a partner in their own care. And check this out. This is a perfect example of how to start that conversation. It's clear, it's friendly, and it immediately explains why you're asking. You're not just being nosy, you're doing this to keep them safe. An introduction like this just sets the perfect tone for the whole investigation. Okay. The very next thing you have to do, and this is absolutely non-negotiable, is ask about allergies. Before you go any further, you have to ask about allergies or any bad reactions they've had before. Think of it like a critical safety checkpoint you have to clear right at the start. And if they say yes, your detective work is just getting started. You got to dig deeper. What was the name of the medicine? What kind of reaction was it? Was it a rash? Or did they have trouble breathing? When did it happen? How bad was it? Every one of these details helps you build a complete safety profile. Next up, you need to get a feel for their routine at home. Asking who's in charge of your medicines lets you know if maybe you need to chat with a family member or a carer. And a gentle question like, "Do you ever forget to take your medicines?" Well, that opens the door to a really honest, non-judgmental talk about how well they're sticking to the plan. And that's vital information. All right, so we've laid the groundwork. Now it's time to really start collecting all the evidence. And any good detective will tell you the most important clues are often hidden way beyond the obvious places, like the prescription pill box. And this is a huge point. You have to ask about everything. Because here's the thing. Patients often don't think of their vitamins or herbal supplements or even eye drops as real medicine, but they are. All of these things can interact with prescription drugs, so you have to uncover the entire story. This slide just nails the whole problem, doesn't it? On one side, you've got the official prescription list. That's what we think the patient is on. But on the other side, you've got reality, what they're actually taking, including all that other stuff and reflecting how they really behave. Our job as detectives is to bridge that gap. And just like any good detective, you don't just take one person's word for it. You have to verify your sources, at least two of them. You talk to the patient, sure, but you also look at their pill bottles. You call their pharmacy. You check their old records. Cross-checking like this is how you turn clues into cold, hard facts. So you've gathered all your evidence, you've verified it. Now what? You create your final report. But this isn't some dusty file that gets put away in a cabinet. No.
This is a living, breathing document that's going to actively protect the patient throughout their care.
Getting this down on paper or in the system is everything. It has to be done right. You need to include all those little details we uncovered, the allergies, the adherence issues, all those over-the-counter products. This is how you make sure the entire healthcare team is looking at the exact same complete picture.
And this is why we call it a living document. Just look at its journey. It gets created when the patient is admitted, but then it gets checked and updated every single time they move, from the ER to the ward, maybe to the ICU, and then finally it goes home with them. It travels with the patient to keep them safe every step of the way.
So when you step back and look at the whole thing, it's pretty clear, right? This isn't just another box to check on a form. Mastering the best possible medication history is a real clinical skill. It's a blend of communication, investigation, and some serious critical thinking, all to keep our patients safe. So the case is solved, and more importantly, the patient is safe. And that really just leaves us with a final thought for you. If you're a clinician, how are you going to sharpen your detective skills? And if you're a patient or a family member, what are the crucial clues you'll be ready to share the next time someone asks you that simple question, what medicines do you take?